Dr. Sheila Nazarian is a board-certified plastic surgeon who practices in Beverly Hills. She also appeared on The Real Housewives of Beverly Hills and Revenge Body with Khloe Kardashian. Dr. Nazarian's aesthetic philosophy prioritizes natural-looking results and long-term surgical solutions to build her patients' confidence and maintain their health.
Sounds about right.
Are you a tits or an ass woman?
I'm like a proportionate woman. Like, I love a good proportion. And usually that's a smaller breast and a very lifted, athletic butt.
But you think the tits and ass work in correlation with one another?
Yeah, like the ratio of chest to waist to hips.
You don't like fat jubbly D's if it's with a flat booty.
I think to each their own, but I just think functionally they can sometimes be very limiting.
But a fat lifted booty works pretty well with some itty bitty titties. How would you define beauty?
Oh my God. I literally define beauty as like, you know, like aesthetic beauty. Like, I just think like it's objective. Like symmetry. It's like, you know, when you see it, you know.
So if for you, is it a bit textbook?
For me, it's a little bit textbook. It is.
Why does plastic surgery get a bad rap?
I think people think of it as like very superficial or unnecessary, but I will tell you, it's either necessary in the sense that burn surgery, for example, hand surgery, microsurgery for breast cancer, for example, reconstruction, it can be very obviously necessary, or cleft lip, cleft palate, things like that. Or even aesthetic surgery, I will tell you that it is so life-changing for people, and that has so many ripple effects to everyone around them, that I almost think about it as giving yourself permission to take care of yourself in a more permanent way.
I totally agree. And I think there's this incorrect superficiality that's applied to it because it is the surface, but that can be just as deep as what's inside of you. And so like, if someone tries to become smarter, we don't denigrate that person, but then if someone wants to become more beautiful, we think of them as shallow. Right. And I don't think that necessarily correlates.
And it's interesting too, there was a 60-minute special. They brought this actress, saying she's a kindergarten teacher, to a bunch of kindergartners. And she was dressed kind of disheveled and whatever, and she, you know, spoke to them and gave them a quick 5-minute lesson. Then they took the same person to the back, you know, straightened her hair, put on some makeup, put her in a cute outfit, sent her out again, and she gave the same lecture in the same voice. And then they asked the kindergartners, who did you like more? And they say, oh, the second one. They said, why? And that's because she was nicer. You know, look at peacocks, look at nature, right? I mean, there's this inherent appreciation and value and importance to beauty, or things that are beautiful. Why do flowers look the way they look, right? So it's just like it's innate, and to deny that is almost unreasonable.
I agree.
So when you look at yourself in the mirror too, for example, they did a study with Botox, where they would Botox people's like anger lines, and those people actually had an improvement in their depression symptoms. When you look in the mirror and you don't look upset, that has an effect inside.
And I think people actually make themselves more depressed by not just accepting that that's the reality of the world, that we are superficial people who do care, that we all care about that stuff.
Yeah, but I don't know if it's superficial or if it's survival. Like, why do we appreciate beauty? You know, there's this other study, I don't know if it's true or not, but they say, why do we like shiny things? Have you heard of this?
No.
And they said, you know, when you're in the desert and you see shiny, it's an oasis, it's water. And so it's a survival mechanism to like things that sparkle. Because that was water, that was your survival in the past.
Right, it could be life.
It could be life.
So, your family escaped Iran in 1979. Can you talk about how that experience shaped you?
We actually escaped in 1985. I was born in 1979, which was the year...
Right when the Shah fell.
Yeah, right when the Shah fell. And actually, I was born in Long Island in New York on vacation so that I would be a U.S. citizen.
Oh, wow.
And we were there, for a month, and after I was born, and went back to Iran because our whole life was there, and then the revolution started. And at the time, they wouldn't let Jews leave, so we were kind of stuck. And my parents could quickly see that this was not going to be a country for their two daughters, as the whole world has seen recently. And it was also the Iran-Iraq War. Bombs were flying everywhere, and we would hear sirens at night.
And what was the escape?
My father was a pathologist, and he had a lot of connections with different pathologists from conferences or visiting professors to Iran that had come, to the university that he used to teach at. And so he told the Iranian government that he was going on a medical conference. And so he left, my mom, my sister, and me behind, and went to Vienna and stayed there, waiting for us and kind of working on getting visas. Meanwhile, my sister and my mom and I went to a bazaar one day, and smugglers put us behind like a closed, almost like a hearse looking car. And we were kind of fetal positioned with strangers that were also getting smuggled out. And then they put burlap sacks on top of us and corn on top of the burlap sacks. And that's how we kind of got close to the border.
Did you know your life was in danger while you were experiencing that?
No, my mom, I was only like 6.5 at that time, so she hadn't told me anything. She's like, just be quiet, be calm, be quiet.
It sounds like your parents did a good job of kind of insulating you emotionally from how challenging everything was.
Yeah, like when the bombs were coming in and we'd watch them coming in, through the window, they'd be like, look at the fireworks. Or when we were going to be escaping through the desert into Pakistan, they're like, we're going to go on a roller coaster right now. And we went very close to the border between Iran and Pakistan, and there was like a bathroom, I remember, that was basically just like a shack with a hole in the ground. And that's when my mom told me that we're going to be going to America.
Wow. You expressed opposition to California's ethnic studies curriculum. Mm-hmm. Can you talk about your issues with this proposal?
So the ethnic studies curriculum in California took out Holocaust education.
Is that true?
It's true.
Why did they do that?
Because they're anti-Semites.
You're very pro-Israel, right?
I'm very pro-Israel. I'm very, I was very pretty moderate, I feel like, but I feel like the left has gone so anti-Israel that it's pushing me more to the right.
Right, there's more of an urgency right now.
For a while.
I started, just full disclosure, I was initially, after the October 7th massacre, I was very on Israel's side, and at this point I feel like it's been an overcorrection and maybe disproportionate in the response.
But let me ask you something. You said disproportionate. What is a proportionate response? Should we go into a music festival and rape the exact same number of women? Should we go into a town and massacre and behead and bake the exact number of children in an oven? Is that what proportional response is?
No, I just mean the number of people dead.
But this is war. So how, and we invest, Israel invested all of its money in shelters and and every innocent life lost is on Hamas. Right? They could have built shelters, they could have built hospitals, they could have built an education system, they could have built technology over there, they could have built all this stuff, but instead they built terror tunnels. And they invested in missiles to bomb innocent people. So if there wasn't an Iron Dome, if Israel hadn't invested in protective technology, all of those missiles coming into Israel would have killed people. So would you feel better if those missiles had killed Israelis? Would you feel like it was more proportional at that point? In Gaza or in Egypt until recently, they teach them that every problem you have is not the fault of your own government, it's the fault of the Jews. The reason why you don't have running water is because of the Jews. It's not because your own government didn't invest in infrastructure for you. It's because of the Jews.
Your essence as a Jewish person, do you think you would feel it even if you hadn't been educated on it?
Yes, and I'll tell you why. And I did. I didn't have an education on this, literally. Like if you would have told me to pick out Gaza, what part of Israel is Gaza, what part of Israel is the West Bank, up until 3 years ago, I wouldn't have been able to tell you, right? But Judaism was very much like in our family and very much in our DNA. So I think the question also is like a lot of people are like, why are Jews the only people that can say I'm a race? Why is it the only religion that calls themselves a race? So when I did my genetic testing, it says 10% Jewish. So if I die today, 2,000 years from now, somebody digs up my bones, they will know I was a Jew. No other religion has land associated with it.
Right.
Right? So it truly predates the definitions of religion and ethnicity. It's an ethno-religion. It's both. It's literally in my DNA.
Right. And I feel that when you talk about it.
If you do your genetic testing, it won't say Christian. Yeah. If somebody does their genetic testing, it doesn't say Muslim. But Jews, it's in our DNA tests. CRI genetics, 23andMe, it will show up because we all come from that land.
What's your skincare routine?
I have my own skincare line, thanks for asking. I think in the mornings, everybody should be using a few things. I use a hyaluronic acid, an HA. I use a vitamin C serum and sunscreen. And I use a sunscreen that almost acts like a cover-up, so it makes you look better. So you're like, okay, I'm going to keep using it. Otherwise, who wants to use sunscreen?
Oh, what a great 2-in-1. And you developed that yourself?
Yeah. And then at night, I think the most important thing is to clean your face, because all the sunscreen, you don't want to sleep in that.
Yeah.
Makes you break out, and also makeup and pollution. And so I cleanse at night. I usually use like a glycolic pad, something that's a chemical exfoliant to get the dead skin cells off and let the new ones come out. And then a retinol serum.
What did people do for skincare before modern day pharmaceuticals?
Depends, like, who you ask. If you ask J-Lo right now, apparently she's only applying olive oil to her skin. So I think skincare, actually, the advances haven't been that much. Like, really, if you think about it and you look at it, formulations differ, quality maybe differs, percentages differ, studies in that sense differ, but it's really, for the longest time, been retinol, antioxidants, whether it's vitamin C, green tea, resveratrol, and sunscreen.
And when was that discovered?
Decades ago.
So, but it's modern. It's like post-industrial revolution type
Yeah,
stuff.
it is. I don't think before that they did anything.
So there's no history of like people in revolutionary times or
Not that I'm aware
Shakespearean
of.
times kind of using...
Well, I mean, you know, like even Cleopatra was putting olive oil on her face. So beauty's always been like something people are striving for. But no, they didn't have those ingredients back then.
Well, so plastic surgery started off for health reasons, to correct deformities and things like that, and now it's moved into more of like voluntary aesthetic improvements.
I haven't really like read up a book on like the progression between, you know, how reconstructive surgery kind of went into aesthetics. But what I will tell you is I think me having done 6 years of training, surgical training, learning how to reconstruct everything from nothing, whether it's a motorcycle accident that ripped off the covering of the knee, whether it's a vaginal cancer and I had to reconstruct a vagina from nothing, whether it's a breast cancer and I had to reconstruct a hole in the chest when the cancer is removed, or reconstruct someone's jaw from oral cancer, it makes a really deep and broad understanding of anatomy. I'm fearful of almost nothing because I've reconstructed it from scratch. Of course I can make it look beautiful, right? Also on the flip side, being trained in aesthetics and knowing what makes someone beautiful or makes a subunit beautiful helps you reconstruct a more beautiful reconstruction. So I think having the broad training in reconstruction makes me a better aesthetic surgeon and vice versa. For example, a lot of craniofacial surgeons that are doing the cleft lip, cleft palate, jaw deformities, head deformities, taking the bone off, reconstructing it, putting it back on so a baby doesn't have a pointy head, for example. Now you see them all in those little helmets, right?
My boy has one right now.
There you go. Well, before that, their bones would just heal wrong and their head would grow in different, you know, cone head or this, you know, kind of like an alien shape. So having done all of those, you know, things, the craniofacial surgeons, the natural path is to go into facial aesthetics. And a lot of them do that. But it's just because it just gives you such a deep and broad understanding of that subunit. So it's a very easy transition to much easier surgery, in my opinion. I think there's nuances to aesthetics. You're taking someone who's already normal and trying to make them better. Whereas in reconstructive, like burn surgery, you're taking a disaster and you're just trying to make it functional.
Yeah, so on the continuum, you're getting them back to a neutral
There's pressure. I think there's pressure in both ways, right? You took someone, a soccer mom, and you're doing a tummy tuck on her. Her stomach's perfectly normal for someone who's had 3 kids, but you're just trying to make her perfect or close to perfect. That's stressful, right? But also having a burns patient survive is also stressful. So I just think it's like a different type of stress, but they're both stressful.
What percentage of A-list celebrities do you think have had work done?
100%.
Do you actually think it would be good for A-listers to say, hey, I've had this and that
I think
done?
it would, and let's just start with like influencers. Like forget A-listers for now, because there's a lot of pressure and you know, magazine articles. But I have had influencers who I've done, you know, Brazilian butt lifts, for example, put fat into their butt. And they're on their Instagram doing squats like that's what did it. And what message is that sending to other girls looking at their Instagram videos? Like, I'm doing 1,000 squats a day. Why doesn't my butt look like that person? Or another example, I did, you know, defining of someone's arms. And she goes to the gym and people ask her, will you be my trainer? I want my arms to look like you. And she didn't say anything. That it's, you know, not from
Right.
training. So I think there's this or at least in my life, this authenticity, and I hate that word because it's so overused, but really just like being an open book and like saying it like it is so rare now that it's so attractive and it's so like courageous almost. Like with my activism and stuff, just saying what I think in America, like I come from Iran, like you get stoned for saying what you think.
Yeah.
And here it's like, and not stoned the shrooms way, stone the actual stone way, and just making sure. And I just think it's so sad that people can't just say what they think or what they did or be themselves.
Yeah, so who I think is one of my favorite actors alive, do you think that's one of the best chin implants of all time?
Yeah, so I've had patients that have had retruded, like severely retruded chins, and putting in a chin implant is life-changing. I had one patient that was very similar to what you just showed me, the pre-photo, and I did a chin implant in her, and when she came for her follow-up appointment, she was almost shaking, and I'm like, what's happening? And she's like, people almost got in a car accident outside because these boys were looking at me. I'm not used to receiving positive attention from men. And so she's like, we could see that it was just like a life shift moment.
Yeah. I think there's this desire in people to believe that a drastic change like that could happen naturally, and it's possible, but it's pretty unlikely, right?
It's not that it's unlikely, it's impossible. How do you feel when someone you respect like that lies, clearly?
I think he's doing his job. I think the thing is, most of America will believe him, and I think they want to believe in the illusion that it wasn't through plastic surgery. And I think he's doing his job when he does that. His job is to be a leading man, it's to look strong and confident on camera, and I actually respect him for doing it, because I think he's filling out the jacket. Okay. And so all these celebrities who get work done, I'm like, thank you. There was a critic I like, John Simon, who was super erudite, and he was very shallow when it came to people's look. He would criticize people in movies who were ugly, and he's like, I don't want to look at that. And I thought it was so distasteful when I was young, and now I get it. It's like, look who's consistently in movies. It's beautiful people. That's what we
people
want to watch.
See beautiful things. It's true.
So it's hard. It's like, how do you balance that authenticity with like the kind of, aspirational fulfillment we get from seeing
I think little by little, it's going to move in the direction of more authentic. Like, I don't know if this was how it was for you, but like even 10 years ago, no one said they got Botox.
And now it's totally normalized.
And now like people drink Botox for breakfast. Just joking. Don't drink it.
No, my girlfriend actually, when we were early in dating, brought me to her Botox appointment, and I got to watch it like bubble under the skin. And it was kind of like disconcerting because I'd never seen anything like that. Right. But it made us closer.
There you go. But literally 10 years ago, people didn't even say.
I hope that's okay. She'll be fine with it, but I just want to.
Yeah.
She's okay with it.
No,
yeah.
but I'm just saying, like,
and
even
she's lovely without it. Yeah.
Yeah. Disclaimer.
So what is that in people that we just want to believe these celebrities just enhance through natural means?
I think because, and I don't know if this is even relevant anymore, but I think in the past, plastic surgery was so expensive and so unattainable.
That it was classist?
It was kind of classist. It was for celebrities or for very rich people. And so to seem relatable or to seem almost like optimistic that if this person can make a change through natural means, maybe so can I, with some like a lip scrub and like a facial scrub. Maybe I can do it too. So I think it made the actors almost like, not more relatable, but like maybe
more achievable,
more aspirational in a realistic way.
Yeah.
But now I think plastic surgery, there's so many different price points, and I think there's so many different devices and things you can do that I think it's not as unreachable and unattainable anymore.
What about some of these new lifestyle practices like mewing or jazzercise? Do you think those have any type of positive results?
Well, I'll tell you, like jazzercise, for example. Like, we know when the masseter muscle becomes,
the limits of its expansion.
Bigger, it can take up some of the skin, so that's what we do with filler. The problem is that can lead to TMJ issues or grinding your teeth issues.
My dentist told me to stop. He
was
like, dude, that's not good for you.
Exactly. And so I think that there's some benefit to it that can be explained like that. Adding volume to the back of the face is going to, pull the skin back a little bit. But it might have other consequences that are
So it might work for some people, but it's not going to work for all people. Like
if it did, I'd be out of a job, let's be real.
Right. Can you explain what CoolSculpting is?
Sure. So CoolSculpting is cryolipolysis. So I know this sounds crazy, but fat is actually very sensitive to temperature. So I know people are like, this fat's so stubborn, it won't go anywhere. But when you cool fat down to a certain temperature, the cells die. And so what cryolipolysis with CoolSculpting does is it lowers that temperature to low enough that it's not freezing your skin and you're not getting frostbite, but it's low enough that the fat cells will start to apoptose, meaning self-destruct. I think CoolSculpting is kind of on its way out. In the beginning, when it was just coming out as a non-invasive fat reducer, I think it was great. I did find, as one of the early adopters of that technology, that it worked better on lighter skinned individuals. And the reason for that is the darker the skin type, the more collagen in the fat. And CoolSculpting doesn't kill collagen, doesn't kill that fibrous like matrix that the fat's sitting in. So for example, a lighter skinned individual's fat is like pure fat. And we see this when I'm doing liposuction too. So their fat is like very fluffy, you can pull it this way, you can pull it that way. The more melanin the person has, the thicker the fat feels. It's almost like grabbing a leather couch rather than grabbing a soft pillow. And so what I always tell my patients too is if you're looking to see if a technology is good for you, go on Google, search up before and afters, and if you're like...
If people who look like you have had good success
exactly.
with it.
Like if you look up CoolSculpting, all the before and afters are light-skinned people because those are the best results.
Does it work better on certain parts of the body? The stomach versus submental?
No, I think it works great on the right person in any area. So you have to really individually, like for example, on me, the applicator won't even fit on my submental area because it's too wide. My face is too narrow.
So your anatomy and your biology has a great determining...
Very much. So people come and they're asking me, is CoolSculpting right for me? If they're a darker skinned individual, I say liposuction is going to be better for you. I think liposuction is better in general for everyone because it's one and done and you're out. But if it is a lighter skinned person and they're like, you know what, I'm not ready for that, sure, CoolSculpt. I know that you're going to get some result.
I think one of the interesting things about some of those laser treatments or some of the cooling treatments is that the results are incremental.
Yes.
It can take 3 months before you really know if it worked or not. But because of that, it's hard to know if it worked at all.
No, that's why we take before and after photos. So that is the plastic surgeon's evidence of efficacy. So we take before pictures, and then you might not notice because it's very slow, right? But when you come in and we take your after photos, it doesn't lie.
But I think there's a lot of distrust towards before and after photos because there can be so much gamesmanship in that.
Yeah, but that's why you have to go to a doctor that you trust.
Can you explain what a thread lift is?
So a thread lift is basically a surgical suture that has been laser cut to have little barbs in it, okay? And when that's put in and pulled, it can hold the tissues up for a limited amount of time, okay? I don't love it. I think there's way better technologies other than thread lifts. The only place I like threads at all is in the chest. You know how when women get older and they sleep on their side, they wake up and they have all those lines in their chest? I kind of put it in almost like a shield, so it prevents that buckling of the tissue. And when the threads are in place, as they dissolve over 3 months, they leave a little bit of strength, a little bit of collagen in that tract. And so that's really the only place I like threads. Thread lifting for the face, I tried it for like a year. And after about 3 months,
Gravity
with all
wins.
the facial movements and gravity, how are those tiny little barbs supposed to hold up your entire face with all your muscles and everything? It doesn't work.
So are you suspicious of the MyElevate?
MyElevate's actually not a thread lift. So MyElevate is a permanent suture.
So you think that one
placed.
could work?
That one could work, but again, I think there's technologies that can compete with it that don't leave a foreign body in the face.
Yeah, it is weird to just have a nylon thread in your head for the rest of your life.
I just want to make a comment that you have to understand there's a barrier to entry for providers and that's money. So for example, let's talk about threads. A box of threads costs what, $120 for the provider. Mm-hmm. So anybody and their mother can get their hands on a box of threads and be like, hang a shingle and be like, come get threads, come get neurotoxins. So neurotoxins, fillers.
And so
threads,
neurotoxins are like fillers and Botox?
Neurotoxins like Botox or Dysport or Daxxify or Xeomin. Right. Fillers like Juvederm, Restylane, RHA, there's different types, right? Those 4 things, neurotoxins, fillers, microneedling, and threads, anybody and their mother can get their hands on and put it on Instagram and open up a shop, right? My cheapest laser costs $260,000. My cheapest one. And I have over 30 devices. So you're gonna hear about what, $260,000 lasers more on Instagram or threads? Threads, because every nurse, every PA, every doctor, every internal medicine, whoever wants to get into aesthetics can afford to buy a box of threads and offer it to their patients. But not every provider can afford a $260,000 laser.
Wait, I'm misunderstanding. Why are you so fired up right now?
Because I just feel like a lot of times people are exposed to things that maybe aren't as effective.
See, I thought what you were saying is it's important to have those things because that's what's available to people who can't afford the more top-end stuff.
Not necessarily. Doesn't mean it's cheaper. CoolSculpting, for example. You have to do 4 sessions, 6 sessions, 8 sessions. I have a guy who's now coming to me for liposuction that went someplace else and bought 50 applicators of CoolSculpting, which is way more expensive than surgery.
You gotta respect the determination.
Yeah, but it's way more expensive than surgery. So it doesn't, just because something costs less now, doesn't mean over time to get to the place where you want to go, it's ultimately cheaper.
How do doctors who are using them reconcile the fact that they did charge people for them and now they're not going to do them anymore?
Well, I mean, if it's the best technology that was available at the time, you don't have to reconcile anything. I mean, that's all there was, right? But as better technologies come by, or for example, let's say CoolSculpting. We have 2 CoolSculpting machines here, right? But I think the pendulum's kind of swinging from non-invasive to like, I want something that's going to fix this. So I think a lot of people are coming in more for tightening, maybe minimally invasive or surgical.
Is that a big part of your job, is convincing people to do the more challenging thing because it'll actually have better results long term?
It's a ladder. It's a ladder, and it's a conversation. So for example, if I think someone's going to get an outstanding result with a laser, I'm not going to operate on them, right? But if somebody comes in and they say, well, I'm deciding between a facelift and maybe radiofrequency tightening, face tight. And I'll say, okay, a facelift will give you 100% tightening. Face tight will give you 40% tightening over a year, but no scars, and we can do it awake.
Yeah.
Which one do you want? But if somebody's in the mirror doing this, only surgery is going to get you this. So if that's what you're imagining as your end result in your head, then you need to do this.
Do you think being pretty is good for your line of work?
Oh, it's essential for female, not for males.
Interesting.
Your male plastic surgeon could look like a troll, and you would say, fine, fix my boobs. But I do this too. Like, I remember early in my career, this device rep came into my office, my old office, and she had terrible skin. And she kept telling me how this machine that she was trying to sell me makes your skin look so good. And the whole time I was like, why don't you fix your own face, right? So I know for a fact that when, like, I have to practice what I preach almost. I can't say, oh, let's get rid of your wrinkles and I'm all wrinkled. It's kind of like your vascular surgeon smoking, telling you not to smoke because it's bad for your vessels.
Right.
So I think as a female plastic surgeon, I think there is a pressure to practice what you preach.
Have you had plastic surgery done?
I've done some, not a lot, but definitely a lot of filler and a lot of Botox since I was 28.
Do you practice on yourself?
Yeah, I inject myself. You can watch it on my Instagram.
That's pretty cool.
Yeah, it's kind of good for Instagram.
Yeah. And it's cool that you can play around as your own kind of like canvas.
You have to, because you have to know what it feels like. You have to know, and also it makes people trust you more. If you're showing yourself, like I will inject my jawline, for example, to pull my jowls back. And I'll literally do it on one side live and then show them, look at what it did for the jowl, like live.
Wait, so you've done filler at the back of the masseter here?
Like literally to augment the jaw. So as we grow older, we lose our jawbone.
No,
We're losing our skeleton, right? So your face is expanding, the skin is expanding because you're losing collagen and elastin, and your skeleton's shrinking. So of course everything's gonna fall down and move forward, right? Your skin's expanding and the skeletal support's shrinking. So it's like,
I've thought about doing it, but then when you see the before and afters online, it's scary with that right angle.
well, it doesn't have to be fake looking, right?
No, yours is great.
Yeah.
Because you didn't make it as like sharp with, some people get that
I
like
know, but then you
that
look like an
boxy
alien.
look. Yeah.
Yeah, you don't have to make people look that way.
It looks very, so how do you deal with that when people keep pushing for more plastic surgery, but
My patients don't. I always say what you put out is what you're going to attract. I put out intelligence. I put out raw and unfiltered. I put out normal, professional, and those are the types of people that I attract. So I have the best time with my patients.
What's the most popular procedure in the world right now?
It's always like in between liposuction and breast augmentation, or by number every year.
And what percentage of your patients are men or women?
I would say probably 90% women.
Oh, nice.
Which is generally what it is for plastic surgery.
And what have you noticed is the difference between when you work with men or women?
Men want to fix it. Women are willing to do more sessions in the office, come back,
Men want to be one and done, and women are more willing to suffer for a bit?
Not suffer, but they're willing to
Put in the time. Men are on camera more or seeing more photos of themselves than they ever have in history.
Yeah.
Do you think that vanity is inherently feminizing?
No, I think that what is really affecting men and women is having to compete with younger people in the workplace and not wanting to look a lot older as a job preservation strategy. Number one. Number two, I think there's this big thing right now on Instagram where, I think his name is Dave Asprey or whatever. He's like trying to look younger than he's trying to be like chronologically young.
Oh, this is that billionaire who spends all day trying to reverse age.
Right. So I think there's just like big push for like longevity right now. So I hear about that a lot. And then just divorce, being back in the dating game.
Right.
Is a big push for people to be like, oh crap, I really let myself go when I was comfortable in my marriage that failed. Now I'm back in the dating pool and I want to kind of feel my best and look my best.
Yeah, and I think it's unfortunate that it's an uncomfortable thing to talk about, but enhancing your looks does change your dating options, and that is important for a lot of people. I talked to a guy who had a hair transplant, and I said, what's been different about your life? And he's like, I'm back in the game. Yeah. And he was happy for it. And there's something about that making him happy that makes people sad. Can you kind of explain that reaction?
Who does it make sad?
I think a lot of people don't want to believe that your looks should so definitively dictate the outcome of your life.
They're just in denial, though.
And what
it's like we discussed, like that 60 Minutes episode where they actually like did multiple experiments from kindergartners up. Beauty is biologically written into our DNA. An appreciation of beauty is biologically written in our DNA. To try to deny that or go against it is to deny reality.
Do you think I'm handsome?
I do. You're cute.
Thank you.
Yeah.
If I was going to go for this thing,
yeah.
Do you think I should do my elevate or should I do a facelift?
Do you want me to give you like a consult?
Yes.
Okay, do you want to remove your hat and pull your hair back? Okay, got you. So I see, we'll start top down, okay? You obviously, I think, have some rhytids, which are wrinkles, we would call it. You have furrows between your brows, meaning that you're making a squinty face or angry face a lot. Your brows have dropped laterally, so your brows are kind of this shape instead of going straight across, which is causing hooding a little bit over your upper eyelids. Your lower eyelids are a little sunken. It makes you look tired a little bit, but maybe you are just tired. I see pores, lots of pores on the nose and mid-face area. Your teeth are crooked, but you already knew that. From the side profile, you already said your chin is something that you worry about. I think it's pretty low on the totem pole. I think you're doing okay in that area. And you're starting to get some jowling. So you're starting to get a little bit of a line, the marionette lines, and a little bit of jowling behind that. But again, signs of wrinkling in men, I think can be endearing, but I don't like sagging in men. And so the things in you that I would do first, beautiful hair. The things that I would do first in you, I would say the jawline and the neck tightening, and also the tightening of the jowls area, pulling that back a little bit would be kind of number one on my totem pole.
Mine too.
The lines here, I would soften those because they're just going to keep getting deeper and
I'm
deeper.
okay with those.
And I think your brows are cute because it kind of makes you look innocent.
I'm dopey.
No, it's innocence. Like it looks like younger and innocent.
Yeah.
But if you want it to look more powerful, which I don't think is your vibe, but again, if you want to look more powerful, like leading man, I would bring up the lateral brow a little bit.
What about my symmetry?
Symmetry's like not bad, actually. You're a little bit smaller on this side of your face.
What about the power of my gaze?
On point. It's a very warm gaze, though.
Can you put your hat back on?
Is that an American flag on there?
Yeah.
Look at you.